We are not just dealing with a pandemic, we are dealing with an infodemic. The number of foolish WhatsApp forwards that I have seen in the last 2 weeks are just staggering. But why blame people? There is just a dearth of verified information. And also, people are scared. We're panicked at this point. We're desperate for somebody to tell us what we should do and what we should not be doing. Helping us with that process are three doctors who've come together to write a book, The Coronavirus, What You Need to Know About the Global Pandemic. Let's introduce the authors of this book. Dr. Rajesh Parikh, Dr. Swapneil Parikh, and Dr. Maherra Desai are with us on the program today. And this is so useful because I think one of the struggles is simply not knowing enough. Also, the science is changing every day. The advice being given to us is literally changing every day. I'll start with you, Dr. Rajesh Parikh, if I may. I know that the idea of this book was born when you were traveling through the Sundarbans and you started reading the history of a lot of the major influenzas, the pandemics that have taken lives in the past. Now, everybody always talks about the Spanish flu. Though called the Spanish flu, the burden that India sort of carried was disproportionate. 6% of India's population was wiped out during the time of the Spanish flu. Even Mahatma Gandhi, as you say in your book, was ill and had to step back from the freedom movement for a while. Rajesh, what do the history of pandemics tell us that we can learn from in this moment of global churn?
First of all, Barka, thank you for having us on your show. And I'm impressed you've gone through the book because, that bit about the Indian independence movement, the Rowlatt Act, and of course, Mahatma Gandhi succumbing to the flu is all towards the end of the book. So what do we learn from the past? Well, Lord Byron once said, the best prophet of the future is the past. And I think there is a lot we can learn from the past. A lot we can be aware in terms of what is available today. So in the past, to begin with the Spanish flu that you alluded to, it was perhaps the worst pandemic in the history of mankind. It wiped out about 100 million of us at a time when the population was just about 1.8 billion. More people died in that pandemic than the two world wars between which it occurred. At that time, because of World War secrecy still being extended in some places, there was secrecy about it. Information was not easily available. People didn't mobilize enough. And strangely, 100 years later, we see some of those same things happening. Right. Secrecy in China, denial in many countries, and people just feeling lost. What's different, however, is at that time it was even difficult to keep count of people, who were ill, who were dead. Today we have diagnostics available for us, fairly rapid testing available for us, and of course social media by which governments can interact with each other. So there's a lot more we can do today, provided we are willing to learn from the past and move on.
Now, it's fascinating that you talk about the clampdown on information at that time, because in China, there was a whistleblower doctor who first outed this story, and that's something that all three of you do tell in your book. Swapneil, before I get to the do's and don'ts of what we should be learning, one of the fault lines of the global debate is how much to blame China for. And your book makes the argument that while China did many things wrong, there are many valuable lessons to learn from China. But you have a Trump who's now calling this the Chinese coronavirus. You have many Indian policymakers who are outraged that the wet markets, the wet animal markets from which the virus probably first originated, are reopened. How do we see the role of China in this? Because the world will ask, why was there not a clampdown on people leaving Wuhan well before and much earlier?
Barka, it's an excellent question. I think there are two parts to that response. The first is, what does it achieve to blame China at this point? Does it save a single life? Does it improve our ability to fight this pandemic? I think it doesn't. So we need to focus a little on action. The second part to that is, well, look at what happened in India. When we announced a lockdown, there was a mass exodus of migrant workers. And it's easy to say, sitting here in India, that China should have done this and should have done that. But let's look at what China's actions did achieve. Their reported new daily cases have significantly reduced from a tremendously high point to a tremendously low point. Look at other countries like Italy, Spain, the UK, the United States. So no one can manage this perfect. If we do everything we possibly could, we would still be a step behind the virus. But what we are saying is that, of course, there was some authoritarianism, questionable human right violations, but China's measures in pandemic response were prioritized and they worked, and we should learn from those that work.
Yeah. So before I get Maherra in, I just want a quick response on this from Rajesh. Rajesh, as somebody who walked with the migrant workers while they were walking hundreds of kilometers on foot, and we were out there talking to them, there is a sense that in a poor or a poorer country like India, a lockdown has absolutely different consequences than it does, let's say, in the United States of America. So many poor people have said to us, the poverty is going to kill us before the virus. What does a country do when faced with such inequality and such poverty as we are dealing with in India? Rajesh.
First of all, Barkha, as always, you've been a frontline worker, whether it's been the war in Kargil or whether it's been terrorist attacks or even now. It was heartening. Maybe it was heartbreaking, I don't know, to see you with those people over there. Not just in spirit, but you were physically there. I think, what's happened with our migrants today is something that generations to come may not forgive us. These are the people who build our homes, who build our factories, who build our nation with their bare hands. And today we seem to have forsaken them. I don't blame anybody for it. Perhaps we could not have anticipated it. But, once it happened, to see how the migrants were being treated, being sprayed with bleach or detergent, I think, that's going to be perhaps one of the biggest tragedies of this episode. We tend to forget sometimes, firmly ensconced in our homes with the luxury of social distancing around us. We are a poor country. Let us never forget that. Those GDP numbers and growth rates withstanding, we just need to look around us to realize how poor a country we are. And I think, as has been said in the book, if one person is not safe in this country, in a pandemic, anywhere in the world, if one person is not safe, then all of us are unsafe.
Yeah.
So it is enlightened self-interest more than anything else, more than compassion, more than empathy, more than doing the right thing. It's our own self-interest to treat our migrant workers well and do whatever we can to help them, to protect them. They are heading back to their villages. They're trekking back almost, at the time of partition.
Yeah.
Some of them may not be accepted readily in their villages. They will undoubtedly take the virus with them. So I'm glad you're drawing attention to that. When we started work on this book at the end of January, that situation was not there. And although we anticipated a lot of what's happening today, we, even in our fervent imagination, would never have imagined the nightmare that's happening with our migrant workers.
Yeah. So, Maherra, let me ask you this. What does a lockdown actually do? Because, any number of doctors are routinely arguing that in the absence of a vaccine, in the absence of verified treatment, doctors are groping in the dark. Some are treating their patients with azithromycin, some are combining chloroquine, some are using the kind of drugs that we use to treat HIV patients. But basically, we simply do not know. Now, the confusing thing is this. Your book talks about how Ebola had a much higher mortality rate, but the coronavirus, the COVID-19, has a much greater spread, a much greater sort of contagious capacity, as it were. Now, what does that mean for how we should respond to it? How sustainable are lockdowns, Maherra? How long can India be under lockdown?
We don't know, Barkha, to be honest, how long, but what is the lockdown likely to do, and what are we hoping for is to buy us some more time right now so that the spread doesn't increase even further. For the coronavirus, as we know it, we call it the R naught, or the transmission rate. Each person who gets infected tends to infect up to 3 to 4 other people. And in India, with a population of about 138 crores, uh, you're talking about almost, a very, very, very high proportion. With Dr. Fauci and international leading infectious experts said that we are expecting about 20 to 60% of the world's population to get infected. In India, you even take conservatively 20% of a 138 crore population. We're looking at 27 crore people. So the lockdown is effectively trying to break the chain, allow the government enough time to scale up the testing facilities to identify, effectively trace contacts and isolate them.
I want to take us through the top myths that you've heard. You know, we're all parts of these family WhatsApp groups where you get crazy things like, eat ginger, go sit in the sun. Now, no harm with those. I don't have a problem with things that don't harm. I think the problem is when myths start harming. And I'll start with you, Swapneil. What are some of the harmful myths that I know that your book addresses some of them, but it's for wider dissemination? What are some of the dangerous myths that you want our viewers to understand are simply not true? Swapneil.
It's an important question. I think there are two factors we need to consider. The first is what are the myths that are harming people, and the second are the myths that the coronavirus is exposed in society. So the myths that are harmful to people, I think the number one is that this virus is going to go away by itself, or it's going to go away because of the weather. Let's imagine for a second that it does decrease a little with the monsoons. Remember that dengue, malaria, other infections spike tremendously around then. So even if we have a 5% or 10% decrease in COVID-19 cases, but 100 or 200% jump in other infections, healthcare infrastructure is going to crumble under that onslaught. And you have to remember, everywhere where this has come under control, it's come under control because of immense public health outreach. It's not just happened on its own. And if we look at other viruses like the H1N1 virus, which we call swine flu, it also jumped from an animal to a human. It caused a pandemic and then went into regular circulation. So then it kept coming back every year as a seasonal flu. That's what we might see here. The second aspect, which is equally important, what are the myths that the coronavirus is exposed in our society? The first, and this is a big one, that government is the solution to our problems and government can save us. We're seeing that that's not the case. It's ironic, we say that this disease, it spreads via hands, it spreads via handshakes, but our destiny is literally in our own hands. We have as much power to prevent the spread of infection and control it, perhaps more so than the government does. And people need to realize that. The second important myth that is exposed is that our healthcare system was ready. It was not ready for this. You cannot scale up healthcare in 2 or 3 months that you have not provided in 2 or 3 decades. We need to be realistic about what we can do. So I think those are some of the important myths that we need to consider.
Yeah, and I want to take that to Rajesh. And Rajesh, the data points that all three of you will know, but our viewers may not know. A new study by Brookings India says that in India, there are 0.55 hospital beds for every 1,000 patients, making that amongst the lowest rates in the world. And we are talking about another interesting data point, 92 million households that stay in one-room homes. So when you tell poor people to stay at home, I'm just wondering whether there's a uniform applicability of that. What do you do with congested tenements where literally people are living cheek by jowl? What do we advise our lower income groups, Rajesh, at this point?
Barkha, the answer is implicit in your question. It's ironic to tell people who at the best of times are crowded 8 and 10 sometimes to a hut to maintain social distance. So what do they do to maintain social distance? They move out of the slums, they go onto the streets, and who do they encounter there? Brutality with police, and I don't blame the police. They are doing their best, and they're under stress too. But they go on the road and they're driven back into their houses. Then we give them a message saying that they need to retain, social distance. It's such a conflicting message. And about the beds, and that's kind of interlinked to this message. Fortunately, in this illness, about 81% of patients, based on data that was culled in China on 44,450 patients that they studied, 81% of those patients are mild. They're virtually asymptomatic. They might at most have a cough. They don't even need to be in a hospital. Then you have another 12% who can also be treated from home. Mm-hmm. So the number of people who will require hospital beds as a proportion of our population is relatively few. But that still means about 1.5 million people at some point or the other in time will require an ICU bed, and our capacity today is 100,000. So how do we maximize? As Swapi pointed out, we can't scale this up now. The only way we can maximize it is with rapid testing, identifying people, maintaining social distancing, contact tracing, and ensuring that people don't move into the moderate to the severe phase. So today we have no option. We have no treatment available other than just washing our hands and maintaining social distance. So in the circumstances that we are, I think people need to understand this. We need to understand that poor people who are living crowded will come out onto the streets. I think they should be allowed to come on the streets as long as they are separated from each other. Mm-hmm. But giving them one message that don't be close to the other, and then showing them the stick to push them back to be together. I mean, that's not only cruel. I think it's dangerous, because what do people do when they're cornered like this? We may be on the brink of tremendous social unrest.
Yeah, that's such an important point, because, when I go out reporting, a lot of times people they can't stay indoors because their indoor space is too cramped and too congested, and they come out on the street. And I think the awareness should be around stand on the street, but stand at a distance from each other where there's no touch involved. Now, Maherra, I do want to talk a little bit about the mythology that people are, or not the mythology, the confusion that people have about their pets. This is a very, very important question, because in some cases, pets are being abandoned. We're seeing this horrifying, and, I know that this may seem trivial right now, but it's not. I know for some people, their pets are their children. They feel as passionately about them as they do about their kids and their loved ones. We saw reports today that a tiger in the Central Zoo in New York, in the Bronx Zoo, I beg your pardon, has tested positive for COVID. We know that this originated originally from animal to human, then human to human. Can there be human to animal transmission? I just want to ask all three of you what we should be doing with our pets and animals. So I'll start with you, Maherra.
Right, like you said, for a lot of people, their pets are like their children. So protect them like your children. We know that children and the elderly are a vulnerable population, so they need to be protected, which means keep them away and maintain appropriate hygiene when interacting with them. Research so far, and especially the case of the tiger in the Bronx Zoo, seems to indicate that there is transmission from human to animals. There was also a case reported in Hong Kong where a pet dog showed weakly positive for coronavirus. However, there seems to be no research to date where a pet animal is infecting its owner. So we need to keep them protected, maintain adequate hygiene. If you are infected, give the pet to somebody else who can care for them.
Yeah. So Swapneil, one of the questions we get from our viewers is, should we become vegetarian? Is it important to be vegetarian at this time? And there's a lot of confusion, right? Because everyone's heard about China's wet markets. Everyone has heard about bats being the origin. And yes, everybody has seen Contagion on Amazon Prime. So that last, I'm guessing all of you have seen it, the last shot, has a reference to the sort of meat and you see the bats and you see the pigs, and you go. And this happened to me. I'm a sometimes meat eater, and when I saw that movie, at this moment I was like, I don't want to eat meat anymore. But I don't know if that response is scientific. It may be human, but is it scientific? Swapneil?
The simple answer is it's not scientific, but it is a human response. So if you want to be vegetarian for humanitarian concerns or for environmental concerns or for spiritual concerns, definitely that's something you should consider. But if your fear is that you will get infected by coronavirus because of a non-vegetarian diet, that's a bit unfounded. You should continue to take the same precautions you would take even in the absence of coronavirus, like maintain meat hygiene, hygienic cooking practices, make sure your food is thoroughly cooked. But more importantly, we also need to realize there is a tremendous industry around animal husbandry. And if we suddenly say that if for an unfounded, unscientific reason that we're going to switch off from meat, it's going to cause economic devastation to a large subset of workers in that industry. So there are these trickle-down effects that need to be considered. From a scientific lens, you can eat non-vegetarian products as long as you maintain cooking hygiene, wash your hands, cook the meat products thoroughly, and as always, try and source them ethically and reduce animal suffering as much as possible.
Yeah, good points. But I did want to ask, because it's one of the most common questions that we do get. Rajesh, when we look ahead, the science is changing. The science is changing, and one of the fascinating things about your book was to read about John Snow, who talks about how cholera, was first diagnosed and spread, and really fascinating story about a woman washing her baby's diapers in the street, and then the baby was sick, and then therefore the infection spreads through the sewage pipes and the drainage pipes, and at that time nobody was willing to believe him. Do you look around you, Rajesh, and hear people saying very sensible things that nobody wants to believe? The modern equivalent of John Snow, where scientists are saying ABC, and there's such collective denial that it's like a modern day version of that John Snow story that you tell in your book.
Well, it's amazing that you've been able to draw this line between what happened in London at that water pump and what's happening today. So, John Snow simply drew a grid map of people who were infected, and he found that the entire infection rate coalesced around the water pump. And he pretty much single-handedly established the science of epidemiology. Today, we're using the same method for contact tracing. We do a test to find out where somebody is ill. We try and, in a kind of a grid map, figure out where people are ill. And then, again, the parallel that you drew is so appropriate, because John Snow was ridiculed. The chapter is titled "You Don't Know John Snow," because people just made fun of it. And we're seeing the same thing happening today. I mean, scientists across the world have been pleading for funding for dealing with infectious illnesses. Yeah. But a lot of the rich nations, until AIDS hit them, thought that infections were not a priority in their world. They needed to deal with cancer and hypertension and diabetes and maybe Alzheimer's, and funding was withheld. Scientists were pleading that infections and viruses and even bacteria do not respect geographic boundaries. They do not respect military arsenals. They do not respect your GDP. They are great levelers. They go across the world. This people have been saying now for a long time, maybe since the end of the last World War, and they were ignored. And today, even when the crisis occurs, you are seeing voices being silenced. Dr. Li Wenliang is a prime example of what happened in China. In the United States, 2 days ago, you must have seen that scene where they fired the captain of a destroyer, the USS Roosevelt. Yeah. That man just pleaded that his sailors be evacuated. He wrote a letter. He jumped maybe a few steps because people were not listening to him. And then the president comes down heavily upon him, and everybody else comes down heavily upon him. And as he walks that plank, the only people applauding him are the sailors whose lives he saved. And the US did exactly what he was asking them to do after firing him. So yes, Barkha, you're right. We tend to ignore people who are trying to help us, who are trying to save our lives. Perhaps the most graphic description of that was the video where they're throwing stones at the healthcare workers who are coming in to help them out. And then maybe to assuage our guilt and make ourselves feel fine, we clap at a certain hour in the evening and make a big ruckus and wait for people to die and then lionize them and, say a few words of eulogy. But I think it's important for us to learn from the past, to act in the present. And, some of our brightest minds today are working on this illness. These are not necessarily doctors. They're basic researchers. They are IIM graduates. They are IIT graduates. They're all working on this. But somebody needs to listen to them.
Rajesh, you've spoken so movingly about the health workers that were attacked, and I happened to interview them. There were two women, Trupti and Zakia, best friends, completely appalled at the attempt in certain media sections to communalize this incident. And they went back the next day. They went back to that same place where they were stoned to do their duty. But Rajesh, I have to ask you at this point that symbolism is all great, rallying a nation is all great. The shortage of safety gear. I've been talking to young doctors, young resident associations across hospitals, and what's happening is that Aam Janta that has no exposure is hoarding up on N95 masks, is hoarding up on things that they don't need, leaving nothing for the doctors and breaking the medical supply chain. Rajesh, I know the science of masks is changing every day, but my understanding, and please correct me if I'm wrong, is that if you're not at the front line, you do not need an N95 mask. I should say I wear one on doctor's advice because I go out and report every single day now for 16 days. But if I was sitting at home, I would not need an N95 mask. If I'm going to the grocery store, I can take a do-it-yourself mask, wear a dupatta around my face and leave that mask for the health worker. Rajesh, can you please talk about the PPE and what regular people should be doing so that they're not hoarding?
Varka, you're absolutely right. You couldn't have said it more eloquently. But despite that, it bears repetition. It doesn't matter if we keep saying the same thing over and over again until it sinks in. First of all, the principle of hoarding in itself is self-destructive in the long run. Because, if we hoard these masks at home and use them inappropriately, we're depriving the people who actually need them, people in the front line, people like you, healthcare workers, doctors, the nurses. We deprive them. We jeopardize their health. But if one of those gets infected, that person is in a position to infect hundreds of others. You see, there is an incubation period, 4 to 12 days, where you could be harboring the virus without being aware yourself or showing any symptoms. So when that spreads that much, it's going to come around. It's going to come back to the people who are hoarding the masks. It's going to extend the lockdown. It's going to inconvenience everybody. And you're absolutely right. I mean, these are medical grade masks. They are required for people who are on the front lines. They may be required for somebody who is infected, so that person doesn't infect other people around them. But in our day-to-day lives at home, we don't need these masks. When people step out, now the CDC 2 days ago, based on some data they've looked at, has advised that it's helpful to wear a scarf, a kerchief, something that is 2 or 3 layered around oneself when one steps out. But you're absolutely right. I mean, you don't need you don't need a high grade mask. I mean, it's like going in an army tank to go for shopping. When you could just as easily walk around and manage things. I mean, just because you have an army tank, just because you are in the military, it doesn't entitle you to take these measures which are detrimental to society.
Yeah, well said. Swapneil, we also need our viewers to understand that hospitals can become vectors. And that's very important. And, we saw this in Rajasthan, in Bhilwara, an entire private hospital, Bangar Memorial Hospital, has had to be sealed off. 13 medical staff had to be isolated. In Safdarjung here in Delhi, 2 doctors have been, tested positive for COVID. In All India Medical Institute, 1. I know in Jaslok Hospital in Mumbai, the hospitals had to deal with dimensions of this. So what do we take away from this? From my commonsensical layperson understanding, it is that if you can avoid going to a hospital right now, Don't burden the hospitals right now. Don't go to hospitals randomly in an entitled way to say, please test me. And that's the other thing that I'm a little scared of. There's suddenly going to be a flood of our class of people going to hospitals. Swapneil.
Yes, absolutely. It's important to know that this infection does start spreading in hospitals. It's also important to remember that this is often a harbinger for increasing community spread. If we look at SARS and other illnesses, or even COVID-19 in Italy, the typical pattern we have seen is outbreaks in hospitals and then large-scale outbreaks in the community escalating thereafter. What's important, we need to qualify it in India though. The vast majority of people in India don't get to go to a hospital when they desperately need to go to a hospital. So our problem in India is a little different. And let me also suggest a solution. Before I was working on the book, I was working on a healthcare startup that was, it was about empowering patients to be more in charge of their own health, not to replace doctors, but also to increase a doctor's capacity to outreach to patients. And me and my co-founder came up with what we call a pandemic time healthcare solution. And we need more of this, telemedicine. It's called DIY.health. And what we do is we use a AI-powered system, but we like to believe that it's human-centered, to enable patients to evaluate their illnesses, stay at home, get a certain quality of care, and alert their physicians if they do need to go into a hospital. This is important for two reasons. It allows patients who have COVID-19 to get a certain level of care, quality care, even when the system is overwhelmed. And it allows, other diseases aren't going away. Diabetes is not going away. Heart disease is not going away. Hypertension is not going away. But these are also the patients who are most at risk of severe COVID-19. So we need to offer them a healthcare solution that allows them to stay at home and receive a certain quality of care. I think telemedicine needs to come to the forefront right now. It's the only way we can scale up some quality of care for these individuals.
That's such an important point that I'll bring Maherra in right now, because I know that the book talks about how China actually used technology to do contact tracing in a reasonably aggressive way. Now, the point is that in some ways technology is going to get us all through this period, whether it's our capacity to be able to talk to the three of you right now using Zoom. It's going to change everything. It's going to change medicine. It's going to change media. It's basically going to change how we live. And my sense is this is not going to stop in the next 2 months. This is maybe a permanent cultural, sociological shift, Maherra.
Yes, it seems so. And the shift has started not just now, since a while. Since the early 2000s, we have been seeing that technology is increasingly used over the past few years, even for telemedicine. The idea and the concept has been initiated. This is the right time to scale it up and to allow accessibility to everybody. Just to add to also what Swapneil was saying earlier, that right now you have the facility to call a helpline number, even for those who cannot access, complicated devices possibly. There's a simple phone number you can call, check with a doctor, and that facility is available. Taking care is going to be essential. And I think in the book we have mentioned that what technology allows us to do in these times is to be socially connected. We keep using the word social distancing, but in the book we've mentioned as well that we'd like to replace that with the word physical distance. Because with social media, you and I are so close, although we're hundreds of kilometers away. So it's definitely going to bring us together.
Great point. Rajesh, last question to you. 2 questions, in fact. It's the cat among the pigeons. Homeopathy. Now, this has always divided medical professionals. I asked because Rajiv Bajaj was on my show a few days earlier. He's a passionate advocate of homeopathy, but there has been no go-ahead from the central government. The Ayush Ministry did recommend it. Rajiv's argument is, right, it's a placebo, but it's a placebo with no harm. And I'm not suggesting use it. I know I can see Swapneil making faces, but I'm asking the question. I'm asking the question because many people in this country are self-medicating using homeopathy. And therefore, I have to ask the question because of just the number of Indians who believe in this. So where do you all come in? Swapnil, do you want to comment on that first? Because your face was like giving you away there.
I didn't realize people could see me. I thought I was invisible right now.
Yeah. But go ahead. Number of Indians are like, should we go and get arsenic, whatever, camphor? We get these questions. We have to be able to have an answer to say to them.
In the universe where homeopathy works, the vast majority of what we know about physics, chemistry, and biology is untrue. So I'll leave it at that.
Rajesh, do you want to add to that? Like, I think the argument from the homeopathy advocates is it doesn't have a downside.
Yes, there is a potential downside. First of all, let me point out that there is no evidence whatsoever, scientific, to suggest that homeopathy will work in this disease. What is the downside? A false sense of security, a feeling that, well, I'm taking something, so I'm going to be fine. And somebody propagating it actively. I'm not saying that's a problem restricted to homeopathy. It can occur just as easily in allopathy. A few days ago, we saw what happened. In France, there was a very tentative, half-baked study. The authors, to give them credit, themselves said that their findings were tentative. But, people read what they want. And the US president, in his usual bombastic manner, went on television, declaring that a cure had been found. And, it had repercussions across the world. In Africa, where that drug, hydroxychloroquine, which is a kind of an anti-malarial, is freely available over the counter, as it is very often in our country, because malaria is endemic over here.
Yeah.
People started taking the tablet like popcorn. And it's toxic. It can result in death. People landed up in ICUs in Nigeria. There were a couple of deaths, even in the US. And I think what happens is when people start propagating and advocating a treatment which is not proven, the harmful side of it is that people start consuming it, then their behavior patterns change, and we are peddling hope, where instead, we should be doing our best to be on the front lines, to helping people, and to doing things ourselves. I have no hesitation in saying publicly that maintaining physical distance is far, far more useful than allopathy, homeopathy, Ayurveda, or everything else put together today.
Well said. But I did ask, in case you're wondering why I asked, because we have to address what a number of mass of our people believe and ask us every day. So that's why I'm raising some of these questions. Just finally, Rajesh, I'll give you the last word. The book, I love the book because it has so much literature. It has so much history, and that is I know that to be your individual passion. Culturally and historically, what do we learn from how masses of people responded to pandemics? A life lesson, as it were, that we can take away for this moment that we're going through.
The positive lesson is we have always emerged victorious. Pandemics have hit us on a scale bigger than this one. The reason you and I are talking to each other today is because our ancestors survived those pandemics. Our direct ancestors survived those pandemics. Everybody who's living in this world today is alive because their ancestors survived not just pandemics, other natural disasters, earthquakes, floods, famines. This country has gone through tremendous famines, starting with the Bengal famine, or even actually before the Bengal famine. So I think the positive lesson for us to draw from the past is that our species, the human species, is tremendously resilient. We are innovative. We are social by nature. We can work together. We can find solutions. The dark side, sometimes our own self-interest goes beyond an enlightened self-interest. There has historically been a tremendous disparity in access to medical care. And I think I speak on behalf of Maherra and Swapneil as well, and we've said it in the book in so many words, that our fervent hope is that whatever we learn from this pandemic, because we will undoubtedly survive, is available equally for all, as much for the poor countries as it is for the rich countries. as much for our migrant workers as it is for us.
Yeah.
That is the lesson we have not learned over these years. That is the mistake we made over and over again. And I hope that we are in an enlightened time where we can learn from our past resilience, where we can learn from our past mistakes, where we can draw upon our collective connectivity and strength so that this indeed becomes our finest and not our darkest hour.
Thank you for saying that. And the book is a really, really important book. Please pick up your copy. It has, it's a sweep of history, of literature, of science, of medicine. And if you've been struggling to understand what is this novel coronavirus, what is COVID-19, how did it start, and what you can do to keep yourself safe, I would call this essential reading. Rajesh, Swapneil, Maherra, thank you so much for talking to us.